This is a video assessing the 12 cranial nerves. The first nerve that we're going to assess is olfactory. Olfactory is a sensory nerve. To assess the olfactory nerve, you'll have the patient close their eyes and give them something to identify through smell. Can you smell this?
Yeah,
What does it smell like?
like an alcohol pad.
Good. The next nerve that we are going to assess is optic. Optic is a sensory nerve, and the way to assess optic is to have the patient identify something and read it. So can you read this line for me?
Alcohol pad.
Good. This is simply assessing vision. The next is oculomotor. Oculomotor is going to be a motor nerve, and to assess oculomotor, we are going to use a pen light, and we're going to have the patient take off their glasses, and we're going to shine the pen light in each eye and see how the pupils react. The next is trochlear. Trochlear is also a motor nerve. For trochlear, we are going to assess convergence. So we are going to take the alcohol pad. See the line that you said it was alcohol pad? I would like you to let me know. I'm going to move it closer towards you. Let me know when it becomes blurry or you have double vision, okay?
Blurry.
Okay, we'll do that 2 more times.
Okay. Blurry. Blurry.
Good. There are instruments that you can use to assess the actual distance of where and when the patient claimed that what they were reading became blurry or double vision. The next is trigeminal. Trigeminal is both motor and sensory. To assess trigeminal, we're going to do 2 things. We're going to ask the patient to bite down in a chewing motion, and also we're going to either use our hand or a cotton swab and assess if the patient felt sensation across their face. Okay. The next is abducens. Abducens is motor, and to assess abducens, we are going to track the eyes, testing to see if the eyes have any nystagmus as they laterally track the object that you are moving in smooth pursuit. The next is going to be facial. Facial is both motor and sensory. For facial, we are going to ask the patient to create some funny facial expressions or some extraordinary facial expressions. So what we'll do is, can you show me a big funny smile? Good. Can you puff out your cheeks? Good. And I want you to just make a frown on your forehead. Good. Facial also, the anterior 2/3 of the tongue is going to be responsible for taste. The next is vestibular cochlear. To assess vestibular cochlear, which is sensory, we're going to have the patient cover one ear, and we're going to whisper something in the patient's ear and have them repeat it out loud.
Bulb. Bulb.
Good. The next is glossopharyngeal. Glossopharyngeal is both motor and sensory. For glossopharyngeal, we are going to ask the patient to perform a swallowing motion. So act as if you're just giving a big gulp or a swallow. Good. Next will be vagus. Vagus is both motor and sensory. I want you to say ah.
Ah.
Good. And now we are at accessory. Accessory nerve is going to be motor, and we're going to have the patient shrug their shoulders. Don't let me push you down. Good. Relax and push up against my resistance. Good. And the last one is hypoglossal. For hypoglossal, we're going to ask the patient to stick their tongue out and deviate it side to side. Hypoglossal is motor. And that concludes our cranial nerve assessment.